Overview. There has been debate recently about how much vitamin D people need to stay healthy and how to tell whether we get enough of it. And in truth, it's complicated. But one thing experts agree on is that vitamin D is vital to our health. Without exposure to natural sunlight or eating foods rich in vitamin D, we may not maintain adequate amounts of the vitamin. That's a problem because vitamin D deficiency can be harmful to bones and muscles. Vitamin D deficiency affects people across the lifespan. Breastfed babies don't get enough vitamin D from breast milk, so they need to take supplements. As people age, it's harder for their skin to produce adequate amounts of vitamin D, which may lead to deficiency. The actual prevalence of vitamin D deficiency depends on what is defined as a level of vitamin D in the blood that is considered sufficient to maintain musculoskeletal health. The Institute of Medicine has concluded that a level between 20–50 ng/ml of 25-hydroxyvitamin D will allow for this. This range of values is consistent with the prevailing view in Europe. However, there are professional societies in the United States that feel that a level of at least 30 nanograms per milliliter is required for optimal skeletal health. In our view, the preponderance of evidence supports the 20–50 ng/ml range, although it is also true that in some disease states a higher level may be required, says Carl Insogna, Maryland, Ensign Professor of Medicine, Endocrinology, and Thomas Carpenter, Maryland, Professor of Pediatrics, Endocrinology, and of Orthopedics and Rehabilitation at Yale School of Medicine. Regardless of what level your physician decides constitutes vitamin D deficiency, therapy and prevention of vitamin D deficiency are straightforward, relatively inexpensive, and safe. We don't feel that there is any measurable benefit when 25-hydroxyvitamin D levels exceed 50 ng/ml. What is vitamin D deficiency? Vitamin D deficiency is the state of having inadequate amounts of vitamin D in your body, which may cause health problems like brittle bones and muscle weakness. There may be no symptoms, and doctors don't routinely check vitamin D levels, so many people are deficient and don't realize it. Vitamin D helps the body absorb calcium and phosphorus, which are important to bone health. When a person is very vitamin D deficient, they cannot absorb dietary calcium well. Having adequate levels is important to absorb enough calcium from your diet. Healthy vitamin D levels also help to improve phosphorus absorption from your diet. People typically get enough vitamin D from sun exposure. When sunlight hits the skin converts that ultraviolet radiation to vitamin D. People also get vitamin D from certain foods, including fish, egg yolks, and fortified milk and cereal, or dietary supplements. When vitamin D levels are low and the body isn't able to properly absorb calcium and phosphorus, there is an increased risk of bone pain, bone fractures, muscle pain, and muscle weakness. In older adults, severe vitamin D deficiency, levels less than 10 ng/ml, may also contribute to an increased risk of falls. What causes vitamin D deficiency? People who don't have adequate levels of vitamin D may be deficient for any of these reasons. Not enough exposure to sunlight, darker skin pigment malnutrition, kidney or liver failure, which prevents the body from adequately processing vitamin D, certain medications, certain types of cancer such as lymphoma, a family history of vitamin D deficiency or childhood rickets. It is important to note that normal vitamin D levels have largely been determined in Caucasian populations. African Americans tend to have lower levels of vitamin D. Much of vitamin D in the blood is bound to carrier proteins, but emerging evidence indicates that when the free, unbound fraction of vitamin D is measured, it tends to be lower as well, say doctors Insogna and Carpenter. Therefore, defining vitamin D deficiency in this population requires a consideration of other factors, such as the levels of parathyroid hormone in the blood and the levels of calcium in blood and urine. Additionally, some people have health conditions that make it difficult for them to absorb vitamin D, including inflammatory bowel disease, Crohn's disease or ulcerative colitis, celiac disease, cystic fibrosis, people who have had bariatric surgery for weight loss, people who have had sections of the small intestine removed, resection, a condition affecting the pancreas, such as exocrine pancreatic insufficiency. It has been suggested that vitamin D deficiency may play a role in certain conditions, such as fibromyalgia, chronic fatigue syndrome, and multiple sclerosis. What are the symptoms of vitamin D deficiency? Most people with vitamin D deficiency don't notice any symptoms. Others may notice vague symptoms that may be signs of any number of conditions. Possible symptoms include muscle pain, bone pain, Increased sensitivity to pain. A tingly, pins and needles sensation in the hands or feet. Muscle weakness in body parts near the trunk of the body, such as the upper arms or thighs. Waddling while walking, due to muscle weakness in the hips or legs. A history of broken bones. Muscle twitches or tremors. Muscle spasms. Bowed legs, when the deficiency is severe. How is vitamin D deficiency diagnosed? Because there are often no symptoms, identifying vitamin D deficiency can be difficult. While a blood test that checks vitamin D levels can be used for diagnosis, it is not routinely ordered for all patients.